It's been a real pleasure to be here. This has been a remarkable conference. It's been a collection of scientific expertise, field experience, and most importantly, dedication to doing good by promoting health around the world. So Judy King, congratulations on a great conference. I know you didn't plan this as a welcome gift for me, but it feels like a welcome gift, and I'm very grateful. I am the incoming Dean of Public Health here. I'll begin next Monday. I have to tell you that my chance to be on the panel this afternoon is not just a chance to think about the future of global health and discuss that with you, but it's a quest. And the reason for that is that, unbeknownst to most of you, when you become a dean at the University of Washington, you are expected to undertake a series of quests, much like the Knights of King Arthur's Round Table. So I've been doing that for the last couple of weeks. I swam across Puget Sound while singing the UW fight song and wearing only this lapel pin, and I climbed Mount Rainier while staying on hold with the IT help desk, and I went downtown and got my Washington driver's license. I went to a departmental meeting. So these were all things that I could overcome. But the final quest is this. 6 days before taking office as the dean, one has to ascend the podium of a very high-powered, impressive meeting of people not in your own specialty. And then one has to give a talk. And not just do that, but one has to do that in the presence of one's boss. So this is the final quest. What I will do is talk about the ways that we can learn from global health as we move forward, both at the level of our Health Sciences Center and at the level of global health programs more generally. There was, during the last couple of days, a lot of discussion about what global health is, and there was no answer. It's a complicated question. It is, in part, a geographical approach to health. It is in part an entire intellectual paradigm, about which more in just a few minutes. But what I'd like to do in the current context is think about global health as a set of operating principles through which we can view the activities of the Health Sciences Center and perhaps of the university more broadly. Our assignment, mine and President Wise, is respectively to talk about the Health Sciences Center and the university. I'll mostly comply with that assignment, but I'm going to leak outside the Health Sciences Center precisely because global health is so broad and so cross-cutting that the boundaries between health sciences and the rest of the university are somewhat porous. So I'll ask, what does global health teach us? What are the questions that global health raises as we think about and contemplate the next steps in global health? Well, within the Health Sciences Center, there are 6 such issues that I'd like to raise. The first is the mix of different health professions. Now, I mean no disrespect to observe that during the last 2 days, the vast majority of the leadership at the conference seemed to have been in the hands of physicians. But much of the talk about successful programs centered on nurses and case managers and pharmacists and technicians. So what does that mean for us here in a Health Sciences Center? Do we have the right balance of professionals at work on global health? Do we need to be more inclusive and rebalance our leadership? And do we need to think deeply about the various health professions and how they come together to advance the global health agenda? Second, the issue of infectious diseases versus non-communicable diseases. As recently as just 5 minutes ago, but constantly throughout the conference, we heard about the need for the non-communicable diseases to be very high on the agenda. But I think it still is true that the origins of this field are very much within the infectious disease world. We had many, many more infectious disease people here than we had oncologists, cardiologists, and psychiatrists. So are we reaching out correctly across the span of medical specialties, and do we need to take steps to penetrate other parts of the medical center than the infectious disease part more completely than we've done, so that the global health agenda is adequately and robustly represented. Third, with regard to infrastructure and systems to enable the Health Sciences Center to tackle global health, I won't say a word about that because Anne's done such a great job at covering that very important area in which to continue to learn and improve. Fourth, the global health curriculum. I personally have a lot of questions about how we work global health into our health sciences curriculum. I'm mindful that we have at our university students who simply want to learn to be orthopedic surgeons and go back to their hometown, and students who simply want to be operating room nurses. Do we need to offer them the same global health curriculum in their health sciences training as we do the students who come in passionate about global public health and wanting to do good around the world? Do we need to segment our audience? Do we need to think about different approaches to global health for different groups of our students? Fifth, the skills that we teach. One of the great gifts of global health to the rest of health sciences and public health is the emphasis on the importance of good management. Good intentions aren't enough. We know that we need programs that work. And again throughout the last 2 days and in the global health literature, we see an emphasis on the collection of good data and the analysis of those data, on management of programs that's effective, on evaluation of programs, hopefully in real time so that programs can be adjusted if need be, on the marketing and communication pieces of our work. These are not necessarily the core scientific components of public health or of global health, but they're critically important. To what extent do we need to alter our curricula so that we're teaching these skills alongside the science base? And is it possible to do it all well? And what are the best ways to accomplish that? And finally, some questions about pedagogical methods within the Health Sciences Center. We've heard a lot of discussion about the instruction in global health, and it's very, very rich discussion. Dr. El Sadr this morning said memorably, "Give us mentorship, not more courses," suggesting that the traditional course format of packaged material isn't the most effective way to learn. Interestingly, we saw the usual assembly of data-rich PowerPoint slides during the last 2 days. Those are very useful for conveying data. But we also heard stories. Stories pack an amazing punch in terms of communicating information and in terms of communicating passion. The session on journalism emphasized the need for telling good stories. In fact, there was kind of a disconnect because we in the scientific world tend to lead with data. Journalists who are very skilled at reaching out to the public tend to lead with good stories. So to what extent do we need to convey information not only with data, but with good stories? Of course, there's the question of long-distance education, which is critically brought into focus by the global health world. So a whole set of very interesting pedagogical questions that global health alerts us to, in which we can focus on both to do a good job at global health instruction, but also to enrich our instruction across the health sciences curriculum. Well, I need to migrate from the Health Sciences Center to the university at large and set the stage for President Wise. And I'll do that in 2 ways. The first is to talk about undergraduate teaching in global health, and the next is to talk about more general upstream issues. There is a growing undergraduate demand to learn about global health. It's a good thing. We need to respect that demand by improving our course offerings in global health at the undergraduate level, as our team here at UW is doing. But undergraduate global health can't just be graduate study light. For the most part, with exceptions such as architecture and engineering, undergraduate study isn't pre-professional study. Liberal education has a time-honored place that we need to value, teaching young people to be thinkers, analysts, teaching them to be culturally sensitive, teaching them to be problem solvers. Many of the same things we do with our professional students, but at a much deeper and broader level. So how do we use global health as a platform for liberal education? My contention is that it's an excellent platform for liberal education. It affords the opportunity to teach most, if not all, of the goals of liberal education. But we need to be very thoughtful about that, collaborating with faculty at the undergraduate level. And finally, I'll end with one of the same things that Tom ended with, and that is by recollecting the environment and climate session here at the meeting. It was an enormously popular session with people crammed onto the floor and unable to get into the room. It was a session that reviewed environmental determinants of health, such as air pollution, springing both from energy generation and from transportation. It reviewed climate change, both some of the problems of climate change and some of the solutions which relate to transportation policy, to urban planning, to agricultural policy, and so on. It was a clear reminder that many of the determinants of health lie not within the health sector, but upstream in transportation, agriculture, environmental regulation, city planning, and so on. We need to engage outside the walls of the Health Sciences Center with people in those fields, global health really won't be successful until it transforms our thinking into very broad thinking, until it motivates us to collaborate outside the health sciences centers, until global health becomes the theme not only for the health sciences center, but for the engineering school, for agriculture schools, for urban planning, and so on. So with that, I want to thank, again, the organizers of the conference and the CUGH leadership for a superb conference, and for teaching me a lot about global health, and for raising in my mind, and I hope in all of our minds, some provocative questions about how to do our jobs better at the university level, and about how ultimately to be of service to the global community in improving health and well-being. Thanks very much.